A very warm good afternoon to one and all present here. Today I am Anviksha Sharma, roll number 15. Got the privilege to present my topic, Vasodilators. So the motive of this presentation is to aware you all about the antihypertensive drugs. There are 5 categories of the antihypertensive drugs. These are the diuretics, calcium channel blockers, sympathetic inhibitors, ACE inhibitors, and the vasodilators. So coming to my topic, that is the vasodilators. So what are vasodilators? The vasodilators are the agents that act as blood vessel dilators by causing vascular smooth muscle relaxation, which decreases the peripheral vascular resistance and therefore the blood pressure. The vasodilators are used as an antihypertensive drug, which have been told you before. The vasodilators are classified into 2 categories. The first one is the arteriolar vasodilators, which includes the hydralazine and the minoxidil. And the second one is the arteriolar plus venodilators, which includes the sodium nitroprusside. Now coming to the mechanism of action. So there are 3 mechanisms of action describing the vasodilators, and that is, the first one is the opening of the potassium channels, which leads to the hyperpolarization of the vascular smooth muscle cell, thus causing the relaxation of a smooth muscle cell and thus causing the vasodilation. This mechanism of action is followed in the minoxidil and the hydralazine. Now coming to the next one, it is the interference with calcium release. The vasodilators act by inhibiting the sarcoplasmic calcium release, which causes directly the inhibition of depolarization and indirectly the repolarization. It supports the repolarization, thus causing the relaxation of vascular smooth muscle cell and the vasodilation, and thus lowering the blood pressure. This mechanism of action is followed in the hydralazine and the minoxidil. Now coming to the last one, that is the ANO generation. The ANO activates the guanylyl cyclase, which converts the GTP into the cyclic GMP, which causes the relaxation of a smooth muscle cell and thus causing the vasodilation. Now coming to the indications and uses of the vasodilators. So phenylhydralazine, it is by mistaken, it is hydralazine. So hydralazine is the second line antihypertensive alternative, which is used in the combination with the diuretic and the beta blockers. Hydralazine is also the antihypertensive which is prescribed in the pregnancy, especially for the preeclampsia. It is also used in an injectable form in hypertensive emergencies. It is also used in the management of congestive heart failure in combination with isosorbide dinitrate. Now coming to the minoxidil. So the oral use of minoxidil is used for treating the moderate to severe hypertension, and topically it is applied to treat the alopecia erecta and hair growth in male pattern baldness. Now coming to the indication and uses of sodium nitroprusside. It is the second line antihypertensive drug which is used in certain hypertensive emergencies. It is also used in the refractory congestive heart failure and acute mitral regurgitation because it causes the controlled vasodilation. It is also used in the patients of heart failure and patients of ventricular dilation because it improves the ventricular activity and the cardiac output by decreasing the preload and the afterload. And now coming to the contraindications, the angina and MI may precipitate in patients of coronary artery disease. So the hydralazine and minoxidil are contraindicated in the coronary artery disease. Hydralazine, minoxidil, and the sodium nitroprusside are also contraindicated in the ischemic heart disease and in the older patients. Now coming to the interactions, the hydralazine and minoxidil are given along with diuretics or the beta blockers as they interact to block the reflex compensatory mechanisms evoked by the vasodilators, which causes the tachycardia, increase in cardiac output, renin release, increased aldosterone, sodium water retention, which causes the hyperdynamic circulatory state, which can lead to edema and the fluid retention. Now coming to the adverse effects, taking first the hydralazine, it causes the reflex tachycardia, fluid retention, edema, and the congestive heart failure, which are due to the action of compensatory mechanism. Now the adverse effects which are caused due to the vasodilation are the flushing, headache, dizziness, palpitation, nasal stiffness, paresthesia, tremors, muscle cramps, rarely peripheral neuritis, and the GI upset. On the higher doses, it causes the lupus erythematosus and the rheumatoid arthritis. Now coming to the adverse effects of minoxidil, the oral use of minoxidil causes a hirsutism, So because of it, it is not used orally nowadays. As the minoxidil is used for topical application in the alopecia areata and in the hair pattern baldness and in the hair growth in the male pattern baldness, so it causes the dermatological reactions such as the local irritation, itching and the burning sensation. It also causes the systemic side effects which are due to the vasodilation, which are same as the hydralazine and even more marked. These are the headache, dizziness and the palpitation. Now coming to the adverse effect of sodium nitroprusside, it causes only mild reflex tachycardia in supine posture and it also increases the plasma renin. It is split to release cyanide which is converted to thiocyanate in liver. Thiocyanate toxicity can cause psychosis, CNS effect, rise in intracranial pressure, and cyanide causes lactic acidosis. Due to vasodilation, the side effects are palpitation, nervousness, vomiting, perspiration, abdominal pain, weakness, and disorientation. The reference of this PPT and the presentation has been taken from the KD Tripathi. So as the Navratri is ongoing, and besides that the Navratri is my favorite festival, so on this it becomes mandatory to wish you all a very happy Navratri, a very happy Garba and a very happy Dandiya. And on this note, I would like to end my PPT and thank you all for listening to me and being here. Thank you so much.